The specialty of bariatrics is one that I chose to specialize in because of the advances in laparoscopy. Laparoscopy is something that I had an interest in early on in my training, and the most advanced laparoscopic procedures are in the field of bariatrics and have been traditionally. Laparoscopy or minimally invasive techniques yield the same, if not better, results because of the fact that patients recover quicker, have fewer scars overall, fewer potential risks for hernia formation because the incisions are smaller. And so they get back to work quicker, less pain medication post-op. And particularly in a patient that suffers from obesity, those are very significant advantages. And the advent of the robot allows us to do laparoscopy to a greater degree, higher rates of laparoscopy. So it just allows us to extend the benefits of laparoscopy because of the dexterity that the robot provides. Some of these operations really do cut down on hunger for patients, and so that's a benefit that is sometimes surprising for patients. Patients do kind of expect to be able to feel satisfied with less food, and that certainly is a tremendous benefit of bariatric surgery. But the fact that the surgery actually does help them with hunger cravings, where they're just not overwhelming desire to go seek food, is really kind of a surprising benefit. The ideal candidate, honestly, is a patient who may have some medical problems relating to their weight, but those medical problems are under control through medical means, be it medication or other treatments. And of course, a patient who is willing and able to be an active participant in their weight loss. And that is an ideal candidate, someone who understands that this operation is going to be a very valuable tool to help them accomplish long-term weight loss, and yet understands that the other side of the coin is an active participation in that long-term weight loss goal. Bariatric patients have to go through several preoperative evaluations: cardiac evaluation and clearance, pulmonary, GI, psychiatry. They need an assessment by a nutritionist as well to be sure that they understand what good healthy eating habits are. So it's an extensive list of things. And we're a center of excellence here at Good Sam, so we do have a comprehensive program where we offer all these different benefits to patients at one institution. Some of the newer operations, such as a sleeve gastrectomy, we're very frequently and commonly seeing excess weight loss in the 90%. So patients are losing about 80 to 90% of their excess weight. And these are long-term results. They're not just the short-term. We're seeing it at 5, 10 years out. And with the proper support that we have for them here at Good Sam, that's why we have, I think, long-term success. Initially, of course, the follow-up is more intense. As time goes by, we definitely encourage a yearly follow-up after the second or third year to be sure that patients have lost the weight and are not regaining weight by maybe slipping back into some bad habits. But also, and very importantly, that they've lost the weight in a healthy way. There are very definite healthy ways to do this, and we need to encourage them to do that by following certain rules and keeping some good habits. I've had several patients who were young women who wanted to conceive a baby, and while they were obese, that just wasn't possible because of infertility, which is a very common medical problem of obesity, infertility in young women. But as we see young women start to lose even small amounts of weight early on, their fertility rates go up, and then they achieve pregnancies and healthy pregnancies after their weight loss. So those are definitely gratifying patients. To see long-term success at weight loss through surgery is really a partnership. It's not something that you should approach as having an operation and then kind of going it alone beyond that. The most successful patients, in my experience, are the ones that understand that it's a partnership going forward and having regular follow-up and understanding that these operations are tremendously successful tools. And if used properly, like any tool, they will reap the benefits of that. Patients should choose Good Sam because we are, firstly, a center of excellence. And that's a very important designation. It means that our results are exceptional and are on par or better than national standards. It's also because we have a very comprehensive program where patients can come here and get help in all facets of weight loss.